All right, ready to gnaw that epidemiologist interview? We're going to deep dive into RoleCatcher's resources and get you totally prepped.
Yeah. We're going to break down not just what to say, but why it matters to those hiring managers and how to really stand out.
First things first, what does an epidemiologist even do? RoleCatcher calls them public health
Oh,
detectives.
that's good.
I know, right? Way more exciting than saying, yeah, like, analyze data all day.
Just a great way to put it. You investigate outbreaks, work out how those diseases are spreading, and then come up with ways to stop them. It's basically like solving these real-life mysteries that have a huge impact, keeping communities safe.
It is. And RoleCatcher's AI can totally change the game for your job hunt. It analyzes job descriptions to figure out exactly what skills the employers want.
You can then use that information to tailor your resume and cover letter to perfectly match what they are looking for.
It's like speaking their language before you've even stepped in the door. That's how you beat the algorithms in those huge piles of applications. Ready to tackle some common interview questions?
Let's do it. A classic one you'll probably be asked is, what inspired you to become an epidemiologist?
Yeah. The tell us about yourself question, but like dressed up. It feels like people either like over-rehearse this one or just sound way too generic.
It's true. And that's why authenticity is so key. Hiring managers can totally spot a canned response. They want to see real passion. RoleCatcher suggests weaving in some personal experiences. Maybe you volunteered somewhere like a clinic, or you were glued to the TV during a documentary about an outbreak.
Yeah.
Those kind of stories show it's not just a job to you, it's something you truly care about.
Yeah. It also shows you're a real person, not just, a resume on a desk.
Yeah.
I bet a really common follow-up to that is, can you give a specific example of a public health issue that really resonates with you and why?
For sure. Have a good example ready. But remember, it's not just about listing facts. It's about, why does this issue matter to you? What really fascinates you about it? That's what they're really looking for.
It's showing how your passion really aligns with the role, which makes sense. Okay, next question. How do you stay current with developments in the field of epidemiology?
This is all about showing you're committed to always learning. Epidemiology is always changing, so you have to show you're on top of all the latest research and trends.
RoleCatcher mentions things like peer-reviewed journals and conferences, but just listing those can sound a bit, well, robotic.
Exactly. Instead, talk about how you actively look for new information. Like maybe you follow key researchers online, or you have a system for reviewing new publications.
I remember going to this conference. It was on infectious diseases a few years back. It was buzzing, like researchers from all over the world, all sharing their latest findings. It really hit me. You need to be part of that ongoing conversation if you want to stay relevant.
And sharing a personal story like that just brings your answer to life and shows how enthusiastic you are. Let's move on to question number 3. How do you approach designing and conducting epidemiological studies?
This one feels a lot more technical. It's not just about knowing the steps, but understanding why each one matters.
Right, so totally. Imagine you're investigating the sudden spike in food poisoning cases.
Okay.
How would you actually design a study to figure out where it's coming from? What data would you even need? What methods would make the most sense?
Okay, so I'm saying it's about showing you can apply your knowledge to a real situation, not just reciting definitions. This is where really understanding different study designs is helpful. RoleCatcher talks about cohort studies, case control studies, all these different types, and each one has its own strengths and weaknesses.
Exactly. A cohort study might be perfect for tracking a group of people over time to see how a certain exposure is affecting their health. But then a case control study, that might be a better fit if you're looking into an outbreak of some rare disease.
So it's all about showing you can choose the right method for whatever situation you're in. You mentioned RoleCatcher's AI before. How does that help with all this?
So RoleCatcher's AI will actually analyze job descriptions to find these specific skills, like the study designs. Then it can suggest really relevant keywords to include in your answers, showing them you've got exactly the expertise they're looking for.
Like having a personalized cheat sheet for each job? I like it.
Yeah.
Okay, on to question number 4. How do you ensure the confidentiality of study participants' data?
Now, this question is so important. You're dealing with really sensitive information, so you need to show how committed you are to data privacy and doing ethical research.
RoleCatcher talks about all those relevant data privacy regulations, but how do we avoid just sounding like we're reading from, a legal document?
Instead of listing a bunch of regulations, bring it to life with a scenario. Imagine you were collecting this personal health data. How would you store it securely? How would you ensure it stays anonymous? Think about de-identification techniques, secure databases, those kinds of things. It shows you're really thinking it through.
Yeah, that's all about building trust, right? Like if I was in a study, I'd want to know my information was safe.
For sure. It's not just about following the rules. It's about really understanding that responsibility you have when you're working with this sensitive data. Speaking of responsibility, this next question gets into another crucial part of the role. How do you approach communicating study findings to stakeholders and the public?
This one goes way beyond technical skills, doesn't it?
Yeah.
It's about being able to explain this really complex information, but in a way that's clear and persuasive, whether you're talking to scientists, policymakers, or even, your grandma.
You got it. And RoleCatcher emphasizes how important it is to change your communication style depending on who you're talking to. You wouldn't use the same language or level of detail when you're presenting to a group of scientists as you would if you were explaining it to, like, a community group, right?
Oh, for sure. I remember one time I was trying to explain this complicated statistical analysis to my friend. She hates math. It was tough, but it made me realize how important it is to break things down into pieces that people can easily understand. RoleCatcher also mentions data visualization as a really powerful tool.
Yeah. Visuals can just make data so much more interesting and easier to get your head around. Think about using, I don't know, charts or graphs or infographics to show your findings. And remember, practice makes perfect. The more you practice explaining your work to different people, the better you'll get at communicating it.
So it's not just about being good with data, it's about being a good storyteller too. Now for question 6, let's get into something close to my heart. How do you approach addressing health disparities in your research and practice?
This is all about understanding that health isn't just biology. It's way more than that. Social and economic factors play a huge role in how diseases affect different groups of people.
That's so true. Two people might be exposed to the same virus but have completely different outcomes based on their access to healthcare, their nutrition, even the neighborhood they live in. RoleCatcher highlights how important it is to recognize and address these disparities in everything we do.
Yeah, and it's not just about noticing those disparities. It's about working hard to reduce them. This might involve designing studies that represent lots of different populations, or maybe advocating for policies that address the root causes, those social determinants of health.
It's taking a holistic approach, considering all that social and economic context, as well as the biological factors. It feels like a matter of justice to me. Everyone deserves a fair chance at being healthy, no matter their background.
Absolutely. And speaking of that wider context, this next question really digs into a key part of public health. How do you approach incorporating social determinants of health into your research and practice?
This one feels closely tied to the last question. It's about understanding that health isn't just about choices someone makes. It's shaped by the environment we live in, too.
That's it. RoleCatcher gives a good example. Think about the impact of housing conditions on, say, respiratory health. People in overcrowded homes or homes with poor ventilation, they might be more vulnerable to infections, regardless of their own personal health habits.
It is. It reminds us that if we really want to make a difference in public health, we have to address these systemic factors.
And RoleCatcher's AI can actually help you link these concepts to particular jobs. By analyzing the job description, it can pick out keywords related to things like health equity and social determinants of health. This helps you tailor your answers to show them you really get these crucial issues.
That's awesome. Okay, let's look at question number 8. How do you approach working with diverse communities in your research and practice?
This one's all about cultural competence and building trust. You need to show that you genuinely understand and respect the communities you work with, knowing that each one has its own history and culture and values.
I remember working on this public health campaign in a community that was mostly immigrants. It was a real learning experience. I realized that what works in one community might not work in another at all.
It's true. That's why building trust and working closely with community organizations is so important. They can help you navigate all those cultural differences, make sure your message actually resonates, and give the communities the power to take charge of their own health.
It's about collaboration, not just coming in with a solution you've already decided on. All right, let's tackle the final question in this section. How do you approach prioritizing research questions and selecting study populations?
This is about showing how you think strategically and how you can identify gaps in the research, gaps that can make a real impact. It's not just about following your curiosity, it's about making sure your research aligns with what's important for public health and using the resources you have wisely.
RoleCatcher gives a good example. Imagine you're working for a public health department and the funding is limited. How would you decide which research projects should come first?
You'd need to think about things like how much disease burden there is, the potential impact of the research, and if it's actually feasible to implement any interventions based on your findings. It's about making strategic decisions that get the most out of limited resources.
It sounds like a real balancing act, weighing up scientific curiosity with all those practical considerations. And this is where RoleCatcher's AI can help out again, right?
Yeah, absolutely. By looking at job descriptions, the AI can figure out what research is a priority for the place you're applying to. This means you can tailor your answers to show them you're on the same page, that your goals match up with theirs.
So we've covered a lot in this first part of our deep dive, looking at key interview questions and how RoleCatcher's AI can totally change your job search. We talked about the importance of authenticity, continuous learning, and ethical research.
We've also focused on how important it is to address those health disparities, incorporating social determinants of health, and working with different communities in a way that's culturally sensitive.
And, it's not just about analyzing data. It's about helping to build a healthier future for absolutely everyone.
So go out there, armed with all this knowledge, and make your mark on the world.
And don't forget to sign up for a free RoleCatcher account.
Yes, it's like having a secret weapon in your back pocket.
It really is. This has been The Deep Dive. Until next time, keep learning, keep growing, and keep making a difference.
Welcome back to our deep dive on becoming an epidemiologist. Last time, we tackled all those important interview questions, giving you the tools to really impress.
Yeah, we did. And we saw how RoleCatcher's AI can be a total game changer, helping you tailor your answers and stand out.
Now we're going to shift gears a little and look at some of the more subtle parts of this career. It goes beyond just those technical skills. RoleCatcher's career guide, it really emphasizes health equity, something that I'm so passionate about.
Yeah, it's not just about identifying diseases. It's about understanding the whole picture, how all those social and economic factors affect health outcomes. I remember reading a case study in the guide about these two communities. They both had similar exposure to a virus.
But the outcomes were totally different.
Oh, yeah.
Because one of them didn't have much access to health care and had higher poverty. It's a real wake-up call. Health isn't just about biology. It's also about the environment we live in, the resources we have, the systems that shape our lives.
That's where that concept of social determinants of health comes in. RoleCatcher does a great job of explaining it, breaking down this complex idea and using clear examples to show how important it is.
Think about a community with, say, high rates of asthma. An epidemiologist might discover that a nearby factory is putting out all these pollutants and that's triggering those breathing problems. But to really address this, it takes more than just finding the source.
Yeah, it's about working with the community leaders, pushing for policy changes, addressing those underlying economic factors.
You got it. Recognizing that health is tied to so many other parts of our lives. And this brings us to another key point. Working with communities. RoleCatcher talks about building trust and those all-important partnerships with the people you're working with.
Yeah, you can't just collect data and analyze it from afar. You have to be there on the ground, listening to people's concerns, getting their perspective, and working together to find solutions.
Right. Early in my career, I was working on this project to try and reduce obesity in a low-income neighborhood. We designed a nutrition program. We thought it was culturally sensitive, engaging. But when we went to the community, there was all this resistance.
Right.
We had totally messed up. Our ideas about their diet and what they liked, we were way off.
Right.
It was a huge lesson. True community engagement means involving people in every single step, from figuring out the problem to designing and putting those solutions in place.
So it's about building relationships, earning trust, and realizing that every community has its own strengths and challenges.
Exactly. And that leads us to another super important part of being an epidemiologist. Being able to explain all that complicated science stuff, but to all kinds of people. You might be talking to policymakers, healthcare providers, community leaders, or even just the general public.
Right, and each audience needs a different approach, a different level of detail, a different way of explaining things. RoleCatcher suggests using data visualization tools, things like charts, graphs, maps, to make that data more accessible and interesting.
It's like telling a story with the data, using visuals to show trends, patterns, connections. Remember, people are much better at remembering stories than they are at remembering stats.
Oh, that's so true. I've found that analogies and metaphors can be really helpful when you're explaining complicated things.
Yeah.
Like when I talk about herd immunity, I often compare it to a fire break in a forest.
That's a good one. Just like a fire break stops a wildfire from spreading, if enough people are vaccinated, it helps protect the vulnerable people who can't be vaccinated. It's about finding those creative ways to make scientific information relevant and easy for everyone to understand.
Okay, let's change gears a bit and talk about career progression. RoleCatcher's Career Guide. It has all these different stages in an epidemiologist career, from entry level to those senior positions.
It's good to see that path laid out, understanding how your responsibilities might change as you get more experience and knowledge.
Yeah, they list all the typical tasks and skills you need at each stage, which can help you figure out which areas you might need to work on or focus on. Like someone just starting out might mostly focus on data collection and analysis, but someone more senior, they might be leading research projects and advising government agencies or healthcare organizations.
And don't forget about keeping up with your education and professional development. EPI is always changing, so staying on top of the latest research and trends is really important.
RoleCatcher talks about getting those advanced degrees, certifications, and attending conferences. It's all about expanding what you know and networking with other professionals. And talking of networking, this is another area where RoleCatcher is so helpful.
Yeah, they have a whole section on networking, listing organizations, conferences, online forums. You can connect with other epidemiologists, learn from them, and find out about new jobs.
It's like a guide to finding your people. And don't forget about informational interviews.
Right, reaching out to people who are already doing the job, asking them about their career, getting their insights. It can be so valuable, even if it doesn't lead to a job right away. It's about building relationships, growing your network, and getting a deeper understanding of what it's really like.
Now, before we finish up this part, I want to go back to something we talked about earlier. Ethics. As epidemiologists, we work with sensitive data, often with vulnerable groups, and our findings can have a big impact on public health policy and practice.
Yeah, it's a big responsibility, that's for sure. RoleCatcher talks about getting informed consent, making sure that data stays confidential, and being open about any conflicts of interest.
It's about upholding the highest ethical standards in everything you do, from designing research to analyzing data to communicating those findings. We need to be aware of potential biases, not make claims we can't support, and always put those communities we serve first.
It's about integrity, accountability,
Yeah.
and really dedicating your knowledge and skills to making a positive difference.
All right, welcome back to the final part of our deep dive on getting ready for that epidemiologist interview. We've gone through all those tough questions, looked at the ethics involved in public health, and even tapped into RoleCatcher's AI.
Now it's all about putting what we've learned into action, landing that dream job. Let's go back to RoleCatcher's epidemiologist career stages. It's not just about planning for the future, it's a good way to see where you fit in right now.
Yeah, those stages break down what you'd typically be responsible for, helps you see which entry-level roles match your skills. Like if you're fresh out of college, maybe it's a research assistant role, data entry, even volunteering in public health.
Those are great for getting hands-on experience and building your network. Speaking of which, RoleCatcher has a fantastic section on networking opportunities, conferences, online forums, those professional organizations. It's like a one-stop shop to find your people.
Don't underestimate informational interviews either. Reaching out to someone who's already out there in the field, it can be so eye-opening. You get the inside scoop, ask any burning questions, and you might even make a really good connection.
Now, let's talk about your application. This is where RoleCatcher's AI really comes into its own. Remember how it analyzes those job descriptions? Well, it does the same for your resume. It's like a compatibility check for your application.
Right. It highlights any gaps, in your skills or experience and suggests ways to make it stronger. And it's not just about throwing in keywords.
No.
It's about writing those bullet points that really grab their attention.
Exactly. Instead of just saying analyze data, be specific. Say something like, analyze data from 5,000 participants and found a statistically significant correlation between X and Y. That kind of detail really makes an impact.
Numbers really make those achievements stand out. And don't forget your cover letter. That's where you get to show your passion for public health and how it fits with what the organization is trying to do.
And RoleCatcher's AI can help you polish it up, make sure it's clear, concise, and really packs a punch. Now imagine you've aced the application, landed that interview. Congrats. This is where all that practice pays off.
It's not about memorizing answers. It's about really understanding the ideas so you can explain them clearly and with confidence.
And RoleCatcher's AI, it can be your coach here too.
Yeah.
You can record yourself answering practice questions and get feedback on everything, from how you're speaking to what you're actually saying. It's like a personal feedback loop, constantly helping you improve.
But let's be honest, the job market can be brutal. Rejections, they happen. But don't let them get you down.
No, absolutely not.
See them as chances to learn and grow. If you're not getting interviews, take another look at your resume and cover letter.
And if you're getting interviews but not the job offers, well, ask for feedback. It's all about constantly improving. The important thing is to keep going, never lose sight of that passion you have for public health. And remember, you're not in this alone. RoleCatcher is there every step of the way. It has resources and support to help you succeed.
So we've gone from understanding what an epidemiologist does to tackling those tough interview questions and coming up with a plan to kickstart your career.
We've talked about the impact you can have promoting health equity and addressing those complex social determinants of health.
It's not just about analyzing data. It's about building a healthier future for everyone.
So go out there, use everything you've learned, and make a real difference. And don't forget, sign up for that free RoleCatcher account. It's your secret weapon.
It really is. This has been The Deep Dive. Until next time, keep learning, keep growing, and keep making a difference.